Hello and welcome to the broadcast. I'm Steve Lubetkin. The next time you walk into urgent care, you might not be greeted by a receptionist. You might be greeted by artificial intelligence. We are talking today with Andrea Giamalva, the Chief Medical Officer of Xperity. That's a company that provides a technology backbone behind 22 of the 25 largest urgent care enterprises in the U.S. And now they've come out with a clinical intelligence solution, they call it, that will help people achieve the results they want when they go to urgent care. Andrea, welcome to the broadcast.
Thank you. Happy to be here.
So tell us a little bit about what Xperity does with urgent care companies and how you are hoping to transform it by using artificial intelligence.
Yeah, so Xperity really has what we would describe as an entire ecosystem of products and solutions for our urgent care providers across the country. One of the most exciting things that we're working on is what we're calling the unportal at this point. It is a way to interact with patients beyond the visit. So there might be components that are happening within the visit, but that's kind of old hat. That's old news. That's what we've been doing in healthcare all along. But really finding those ways to capture the entire patient journey and using what we consider the unportal as a way to do that in a fashion that they're able to engage when they're ready and on their terms and not have to remember a password or a login or download an app that they have permanently on their phone. And that would interact with all of the solutions that we already have in place, things like e-registration, the electronic medical record, the bill pay options that we have, all coordinated in a way that the patient is able to seamlessly interact with all of that.
So walk me through the process. How does it work for people who essentially are casual users of urgent care? Urgent care has become sort of the substitute for going to the emergency room when you have something that comes up suddenly.
Absolutely. And you raised the most important point of all, which is that most users of urgent care are what we would call casual or kind of here and there, and not really interested in having that continuity of care connection to their clinic, hence not interested in maybe downloading an app or having a portal that they have to remember all this information for. So what it looks like right now today with clinics that we've already piloted with is that after a patient leaves a visit, they immediately get a text message that initiates a agentic conversation with them. So they can get their discharge paperwork and they immediately can click on that link, enter their last name, date of birth, and have access to that information without having to, again, kind of engage in that I'm connected, I'm committed to this clinic per se. And then beyond that, our next phase, which is rolling out in the next week, is that those lab results that maybe you were waiting on or waiting for a phone call, or maybe some people even drive all the way back to the clinic to get, you can simply receive by that care agent unportal, which is that connection to you through your cell phone number. Again, last name, date of birth. Quickly enter that and you're able to see those results. Future iterations will be things like that pre-registration component. So again, thinking of the patient in this circular approach of it's not just a linear start to finish. Patients have care needs that happen at any point in time. And so the next time that patient needs care, they're able to connect and engage with that agentic agent and say, hey, is there availability today? Get registered for that appointment. Maybe that next phase and tier is to do triage questions, have those questions teed up for the patient so that that provider has information before they even walk in the door. And additionally, on the provider side, not just thinking about how this can help improve and enhance the patient experience, but also the provider experience. So what types of AI technologies we can lean into to do things like summarize that patient, a patient you've never met before, right? This is urgent care. So the likelihood is you've never met the patient before. So really bringing all of that information front and center in an AI format, summarizing, saying, here's your patient you're about to meet, gathering information from outside sources and being prepared and much more in tune to what the patient might need when they walk through those doors.
So after the patient is seen in the urgent care, does the artificial intelligence platform look at the results and make any recommendations for further treatment?
So we are not engaging AI to make clinical decisions. That is a great question. I think a common question that patients especially are concerned about, and even providers for that matter. So at this juncture, AI is simply enhancing or providing additional support to the clinical decision-making that needs to happen and really trying to remove any and all friction of that administrative burden and administrative workload that has historically really pulled back the ability to see more patients and get more patients seen where they they need to be seen at the right time as well. So again, kind of continually shaving away at those extra minutes, those extra hours that all add up and essentially add up to not being able to see more patients when we already know there's a massive supply and demand issue in the healthcare industry as it is.
Some of the concerns that we see coming up with artificial intelligence applications tend to be around hallucinations. The artificial intelligence somehow makes up facts about the situation.
Right.
How are you guarding against that kind of thing happening in a medical setting?
Yeah, very great question. So the most important thing is to set those guardrails in place from the start. And those guardrails for us are that the truth comes from the electronic medical record that we already, provide to these clients across the country, and that this platform is engaged and integrated into. So what that means is that the agentic agent would not be able to provide any information beyond what is explicitly in that format, so to speak. So if the question in the future might be, hey, how many times in the last year did I come in with strep throat? It would be able to summarize that information, send it over to the patient, but then it's not going to tell the patient, because of this, you should see XYZ. It may say, because of this, you should consider talking to a provider. Would you like to schedule a visit? So again, making sure that those guardrails are such that we're taking that extra time and friction and wait times on the phone away from the clinical staff that really don't have the time to connect with patients. They're talking and engaging with the patients that are in the clinic, but be able to then summarize and provide that information to the patient. Or on the flip side, maybe a provider is engaging with a patient and has to ask the question of the unportal or the agent, how many times has this patient had strep throat? Or how many times has this patient had an ear infection? And simply using that plain language to gather the information in a quick format to be able to then move on quickly and efficiently and get on to see that next patient as well.
And the other question that also concerns people is the security of their personal data.
Correct.
How do you ensure that the AI is not giving out personal information to the wrong person?
Right. And so the actual quote unquote login process, which does not require a memorized username or password, uses really three types of identification between the cell phone number that you are currently using. So only the cell phone number that you provided, and then acknowledging that it's the cell phone number that you are responding from, in addition to that confirmation of last name and date of birth. And so essentially what some people kind of recognize as their personalized ID, their face ID, this is my cell phone, this is my personal device, and able to then use that to connect with the agent.
So how soon do you expect to roll this out to urgent cares around the country?
Yeah, so the good news is we've already piloted the first iteration, which is discharge documents, and that has already been successfully and efficiently rolled out. Within a week's time, everybody was excited about it. More than 70% interaction with the patients in about 50 clinics in North Carolina and South Carolina. And then in the next week, we will be engaging with some of our enterprise clients, which are across the entire country. So those engagements will include, of course, the discharge documents. And the good news about this is that we are able to quickly and effectively create customizations and next steps over time. And it doesn't require things like big rollouts or sending, a lot of next steps and needs for our clients, because we're able to do this in a very efficient manner. So very quickly, labs are coming. Like I said, that's in the coming week with our pilots. And then more and more to come as time goes on and we continue to engage in these specific areas of patient need.
How soon will we be able to see something like this in New Jersey?
In New Jersey, well, probably within the next couple weeks, as long as there's one of our enterprise clients that says yes and engages.
Andrea Giamalva, the Chief Medical Officer with Xperity, thank you for joining us on the program today.
Thank you for having me.
And that'll wrap things up for this edition of SBN Newsmakers. If you have comments or suggestions about our broadcasts, please email me at steve@statebroadcastnews.com. For all of us here at State Broadcast News, I'm Steve Lubetkin. Thanks for joining us, and we'll see you out there on the net. Take good care.